Hello, good afternoon, everyone. Good afternoon. Thank you so much for joining me this afternoon on SkinCeuticals.com, on SkinCeuticals IG Live. Sorry, SkinCeuticals everything for me today. I'm so glad you are here. We are looking forward to today's conversation with Claire, and we are getting ready to go live. So glad you are joining us. And there she is. Hey,
Claire, how are you?
I'm doing great. I'm doing great. I'm so glad we were able to connect, and we've got all kinds of folks joining us. Bonjour. Thank you for telling me I've got gorgeous skin.
Wonderful.
I love it. We're getting all kinds of comments. Claire, getting started. So I will go ahead and kick this off because I'm excited about my conversation with you today. For those of you just joining us, my name's Nicole Robinson, and I've been with SkinCeuticals for 7 years. And you are with me on Instagram Live with Claire Brennan-Stanko, who is at, the Skincare and Laser Center located at Central Dermatology in Chapel Hill, North Carolina. So I'm in Texas, she's in North Carolina, and we are coming to you live to talk about healthy skin. And I'm excited about this conversation because Claire has been dealing with patients who have this, and the more and more that I'm out, Claire, I am starting to be affected by my beautiful mask, and and it's real, right? And so we are starting to see that there are some skin concerns that are popping up for everyone involving their mask. And so I just want to talk to you today, Claire, about how do we have healthy skin while wearing our mask, and what should we do because we're seeing dryness and we're seeing maskne is my new word is that that's popping up. So I'm going to turn it over to Claire to introduce herself some more and kick us off in our conversation.
Okay, hi. Hi, thanks for having me, Nicole. And I work for Central Dermatology Center, the Skincare and Laser Center. It's part of a larger dermatology practice in Chapel Hill, North Carolina. My name is Claire Brennan-Stanko, and I've been an esthetician here for 13 years. And we've had SkinCeuticals at least half that time, probably more. It's definitely our favorite line and our patients' favorite line. Mm-hmm. I have been having a lot of people come in lately asking me about the irritation and the dryness and their acne that the mask is causing, and especially for people who have to wear it all day long. Seems to be that if you have oilier skin, then it's causing breakouts, sometimes even cystic acne, and people that tend to have drier skin are seeing red marks, like I'm even getting kind of stripes right under where the mask lays, or just general patchy dryness and flakiness under the mask. So that has been the question of the months of the summer. And I have a few products here that have been my favorites for that. So what do you think, Nicole? Should I just go through the recommendations, or do we have any specific questions to start with?
We did have a specific question, and your recommendations may help with that. And the first one was, how do they deal with the oiliness when you're working out and you have your mask, because you're sweating, you've got your mask on and doing that. So maybe some of your recommendations will help address that.
If you're prone to oily skin to start with, of course we're all sweating under our mask, and we're here in North Carolina, so it's very, very humid, but I think generally across the country everyone is sweating under their mask this time of year, I guess in the US. LHA, cleanse and tone are probably the best nighttime or even twice a day if you're oily or acne prone. I think that helps reduce oil production in the skin. Again, if your mask is on, it's going to be hard to stop sweating. But even when you're working out, when you take the mask off, go ahead and cleanse and tone again, like midday or whatever time your workout is, to help reduce that maybe bacteria growth that you're getting, or that excess sweat buildup underneath the mask, and get a good cleanse in after your workout. That being said, you might not, if you have a morning workout, you might not want to cleanse before. You might want to wait until after. your workout and then do your cleanse, because we also don't want to over dry the skin. Then you're cleansing too many times with an acne cleanser and getting dryness, which can be worsened by the mask. I was just going to show you, this is the LHA cleanse and tone that I'm recommending. This series also comes or has a counterpart called Blemish and Age that works great, and that would be more of a nighttime either spot treatment, or again, if you're really oily and acne and your skin can tolerate it, you can put it all over before you go to bed at night. And it really helps with the breakouts and reducing that oil production.
Oh, good. So that's some really good advice. So just for every day, Claire, for, not just an exercise, but what is your recommendation for a morning routine and prepping yourself and prepping your skin for being in a mask all day long?
Mm-hmm. So morning routine, this is probably part of my usual recommendation, but especially with the friction of the mask, and in this humidity, some of the bacteria growth we can get under the mask, is to have a nice cleanse, but probably a gentle cleanser, and then a good ascorbic acid serum on, which SkinCeuticals does have the best, which is either CE, ferulic, or Floritin. CE is probably I think the more popular choice because it hits a broader skin type. So there's normal skin types to drier skin types, and then the oilier skin types. If you're getting a lot of acne, if you notice that your pores are larger and you produce a lot of oil through the T-zone, the Floritin is probably your better choice for antioxidant in the morning. And this will help protect your skin. It's this product here. It is ascorbic acid, ferulic acid, and tocopherol or vitamin E, which all of those help reduce inflammation in the skin and then provide some moisture and help improve the protective element of the skin. So that's going to help reduce that redness that you're seeing with the mask. It'll help keep some moisture in the skin without being too heavy of a moisturizer. And this can go on every single day, and it's a really tiny amount. It's about 5 drops all over the face, neck, and chest.
Yeah, gotta love our antioxidants. Starting. Okay, they want you to show it again so they can see the name.
They're the best.
So bring the product back up, Claire, so they can see it.
Can you see me?
So they can see that CE ferulic. Yes, it is our best-selling product at SkinCeuticals, and our antioxidants are fantastic. And it's in the morning, every single morning. And I always tell everybody, it's your morning orange juice. So no matter what, you got to put that CE ferulic or your Floritin on.
Exactly.
Mm-hmm.
And you can see, I know you can't quite see my hand, but that's 3 drops that I just put on my hand. It covers like quite a bit of area. So it does not take much. You just put a few drops on the tip of your fingers and you can tap all around. This is definitely a recommendation, mask or no mask. It's great for anti-aging and anti-redness, and just really preserving the skin and keeping those lines and brown spots from coming in over the years. But I do think it's really helping people with the mask irritation as well.
Yes.
Again, Floritin.
And Claire, we got another question on Floritin. Yes.
Okay,
so show us the Floritin. They want to know the difference between the two. And I know you mentioned it, but if you'll mention it again when you talk about Floritin, that'd be great.
So this is Floritin, and they look very, very similar. So you need to, when you buy them, just make sure you're choosing the right one. The CE is the one that's more for drier skin types or normal skin types. That's if you don't have a lot of excess oil production, or you don't have, if you're prone to acne, the Floritin is what you want. Floritin is acne prone, oily. If you're really fighting darker patches on your cheeks, Floritin's also an excellent choice. But if you experience any drier skin, or if you feel like your skin is maybe a little oily here, but otherwise normal, the CE ferulic is probably the better choice. If you feel like you need moisture, the CE gives a lot more moisture to your skin than the Floritin does.
And Claire, as you were showing the antioxidants, of course, we got a lot of questions on the antioxidants, but you had mentioned blemish plus age, and there was a question of which is better, CE for Fibrotic or blemish plus age defense. And I know you probably agree with me, they're different, and they both need to be used.
Right.
You can't compare the two. You need your antioxidant, but if you are prone to developing blemishing on the skin, you've got excess production of oil, then definitely using that blemish plus age all over, spot treatment. I mean, I'm sure you probably have recommended using it all different types of ways. Can you talk a little bit more about blemish plus age defense?
Sure. This is this bottle. So it does look very similar again to the antioxidants. These are great bottles because they're dark on the outside, so they really protect those ingredients inside. But this is the blemish and age, and this is a product to help reduce pore size, reduce acne breakouts. It is different than the antioxidant. The blemish and age is, I usually recommend at night that you would put this on. So it's going to exfoliate. It's a blend of alpha hydroxy acids. It's going to take dead skin off. It's going to target bacteria. It's going to help reduce oil production in the skin, even help reduce the dark spots that we can get from leftover blemishes. But it's not preserving the skin or preventing wrinkles the way that the antioxidants would. It's not blocking or helping to reduce UVA absorption the way that antioxidants do. So it is a completely different product altogether.
And you can use them together, which is great.
You
can use them together.
And usually the blemish and age, it doesn't have to be, but that's usually where I put it as a nighttime.
Yeah.
The antioxidant would go in the morning, and your blemish and age would be evening product.
Perfect. Thank you. And that answers the question that just came up about CE in the morning and blemish age at night. And so when you're talking about the routine and you talked about gentle cleansing, what are your cleanser recommendations from SkinCeuticals that are gentle and should be used in dealing with some of the mask concerns that we have?
So I brought this one over. There's several great gentle cleansers, but the soothing cleanser is that this cleanser is for absolutely every skin cleanser. So if you're dry, if you're oily, if you're acneic, this is a really gentle cleanser, and it's a nice foaming, but lightly foaming. It's not going to strip the skin at all. Let's see if you can see that.
Yeah.
And this can be used twice a day. Can be used on very irritated skin, but it still gives you a nice cleanse and preps your skin for your application of CE ferulic or Floritin, or for your application of blemish and age. I love it. The physicians a lot of times will recommend that the most inflamed skins, that being like different types of inflammation in the skin, they send them over for soothing cleanser. Now I have drier skin generally, and my favorite is the gentle cleanser. So that one, I didn't bring it over to show you, but it is a creamy cleanser instead of the light foam. It has a little grapefruit extract, so it's a really, really nice kind of wake you up smell in the morning. That one I love too, but I feel like, and I think that one would be fine for all skin types as well. I do feel like my oilier skin patients prefer the foaming texture. So some people don't like that creaminess in the gentle cleanse. In that case, I would recommend the soothing cleanser for a gentle choice, but you still get that foaming action that makes you feel like it's really deep clean.
It's like it's cleaning and taking care of it. Great. So you got two choices. If you like the cream, you can go with gentle. If you like the foam, the lightweight foam, you've got your soothing foaming cleanser. What other recommendations you have? We do have a couple of other questions, but I want to get back to your recommendations on what we can do for healthy skin with the mask, because I know it's so important, and what steps we take to kind of maintain our skin right now.
So, and the twice a day recommendation for the cleanser, let's say, would be soothing cleanser or gentle cleanser. And then morning time, your antioxidant would go on next. And I'm loving the Phyto Correct serum right now as a moisturizer. So this is really going to calm that redness down if you're seeing a lot of redness from the mask. But it also is my favorite moisturizer for acneic skin, because They feel really good about it because it's a serum. I'm going to try to show you again. Another serum,
Love it.
which you can tell, I love my serums, especially summertime when it's so humid here. This is a really light hyaluronic acid serum with a little cucumber and thyme extract.
Yes.
So it has an antibacterial property to it. The hyaluronic acid is moisturizing and the cucumber extract is really calming, and then it just disappears. So we're not putting like a heavy layer on the face before we go out in the summertime or have to put the mask on, which is also making things feel kind of heavy or oppressive right now. And then in the morning, I would go from CE to Phyto to sunscreen. And I didn't bring a sunscreen over, Nicole. I'm sorry.
That's okay.
SkinCeuticals has a great array of sunscreens, some mineral formulas, and then some blended formulas that are super gentle on the skin and really, really good protection. And we're still exposed up here, you know, and I think the mask is giving us some protection from the sun. But I do think the zinc-based sunscreens also give a little added protection from that friction that the mask is causing as well.
Very good point. We got to stay protected regardless. And Claire, so that brings us to other areas that people wanted to talk about. And I know then we'll get to my favorite product that you're holding right there.
I have one more to talk about.
I know. We got to talk about that.
For sure.
But two of the other areas are, okay, we're having some issues with the eyes. They want to know about eyes and dryness, puffiness in the eye area, because now all you see is everyone's eyes.
That's true.
And what to do.
I'm feeling that myself. So being at a dermatologist office, there are neuromodulators out there that can help with this tremendously, and kind of get things, you know, improved right along the sides of the eyes and the crow's area. But probably my best pick for a topical would be the AGE eye. It sort of has everything that you need to help reduce that creping, and strengthen the skin's elasticity or bounce back, and put some moisture in the area as well. And a little caffeine extract, right? Well, that helps with inflammation in that area too.
It does. It really does. It has that blueberry extract, and that really does. It helps to work on in those lines, and just really doing a beautiful job of protecting the skin. And so we talked about eyes, and thank you. AGI is my favorite as well. And what should we do for dry lips? Because that has been a common concern, because you're not wearing lipstick as much. You're not putting on your lip gloss, chapsticks. Do you have any recommendations on what to do?
Yeah, well, when we're putting on our, I'm going to say the nighttime, which the Hydro Balm is probably my favorite for just moisturizing.
Nice.
But there is a lip treatment from some SkinCeuticals that can go all the way around the upper lip and the lips themselves. The antioxidant lip repair. And that can be used twice a day. And I usually in the morning would use it right along the edge of the lips, like around upper lip, and then put lipstick on, although lipstick's not happening a ton these days. So you can, and then at night, I would put it all over the lips, including this, the fine line area. But I guess these days we can put it everywhere because we're putting the mask on right after. That's a great antioxidant and moisturizer for the lips, and it'll give you some plumping as well, so they look a little bit fuller. But I've had a lot of people complaining about pretty severely chapped lips, and the Hydro Balm is a great repair cream. So if you're getting cracked lips at all or really uncomfortable, the Hydro Balm I love to put on at night before I go to bed.
Yeah. Very good. Thank you. Thank you for answering those questions.
Sure.
And now you've got a favorite. That's one of my favorite corrective moisturizer.
The Triple Lipid Repair. Yes. This is SkinCeuticals' best moisturizer. And it's really, really working well for people who are getting a lot of redness, or especially the friction, irritation from what the mask is doing right now. And if you have a drier skin type, you can put this on in the morning. Like you could use the Phyto Correct and then put Triple Lipid on. I definitely can put this on in the mornings. I might not put it right on my nose and chin. I'm a little combination, but I definitely put it on my forehead and outer cheek area every day. And then at night, I tend to put it everywhere. And most of us are retinol users around here. I do back off a little bit in the summer because I'm out, walking and a little more exposed to the sun. But this is great to go on top of your nighttime retinoid. Or you could rotate and just use the retinol one night and the triple lipid on top the next. But this really helps restore the barrier function of the skin. And that just means that things, won't irritate as much. Like when that mask is rubbing on your skin all day, this gives you an extra layer of protection and moisture in the skin in order to heal itself from all of this.
Perfect. Yeah, I love it. You can't
Contact.
go wrong. You can't go wrong with triple lipid. And so that brings us to our next question, because you did kind of mention retinol and at night. What is the nighttime routine? What should we do at night? And once we come home, we're able to lay down our mask at night and get ready for the next day. What do you recommend?
I still like the soothing cleanser, maybe a gentle cleanser. Now, if you're acne prone and you're seeing a lot of breakouts and you're having a lot of excess oil production, the LHA 1-2 step is perfect. We always recommend a retinoid. Again, like I said, if you're outside a lot in the summer months, maybe back off the retinoid, but then you could put your AGE on. I like the Phyto first and then your AGE on top of that, or your Phyto first, then a retinol. If you're skipping the retinoid because it's intense summer months, if you're running, if you're walking, then the AGE rotated with triple lipid would be good, because the AGE helps with the elasticity in the skin, and the triple lipid, like I said, is going to help restore that plumpness and firmness in the skin.
And give you that nice hydration and moisture. Okay, so we're getting some questions going back to AGE eye complex, and I don't have any AGE sitting with me because
I didn't bring it over.
I took mine to my bathroom. Sorry,
you have so much fun.
I've got everything but that. But they were just asking from an application standpoint. Where I'm applying AGE eye complex, and just to answer, I usually use it's in a little pot. And I use my ring finger. I've always heard the ring finger has the least amount of pressure out of any of your fingers. And I usually do it on the orbital bone, right down here, and then right on my brow bone, and kind of let it melt down on the eye. Are there other recommendations that you have, Claire, on how to apply AG eye complex?
I do about the same. It's usually the ring finger. It doesn't take very much, and I just get kind of a thin coat. I tend to do like a circular motion, but I think that's mostly because I'm used to applying things to other people. Yeah. It definitely is, a light application, and I go over the lid as well, definitely under the brow area. Yeah. And it's a twice a day product, and that tends to be all I need for my eyes. I feel like it's enough hydration, and it gives me that bounce back that I'm looking for. And I've noticed with the mask, it's squishing everything up. So I absolutely understand what people are writing in about. The struggle is there for sure, but I love the AG. It's my favorite as well. Yeah, and AGE eye complex, AG interrupter for the face. I think both of them, really help. And you're welcome, Contempo Skin. We were able to answer Contempo Skin's question on the AG eye complex, so I'm glad we're able to do that. And so we've got a nighttime routine. You can use your retinol or rotate and do a little and back off of it, because we are in some of the summer months. You got your cleanser. Is there anything else at night that you would do? You've got AG interrupter, or is there any other things? How do you think about masking and using either the clarifying clay mask or the hydrating mask? I think that, and I brought the Phyto mask over as well.
Yes. Oh, that's a good one.
And I think that's a great calming. So if you're redness prone, so if you take your mask off at the end of the day and your nose is red, you have marks, or indentations there, then the Phyto mask is great. And this, you obviously wouldn't use your serum. You can put this all over and wait 10, 15 minutes. You can't leave it on too long, but I would give it at least 10 minutes. It absorbs really well. So a lot of times if I'm very tired, I will go to sleep with this on, and it just disappears into my skin. But if you want to go ahead and do your nighttime application of AGE, let's say 10-15 minutes, and then a cool rinse, and then you can apply your AGE eye and your AGE face. The clay mask I think would be great weekly, probably, for acneic skins, or even just people that feel really oily this time of year. It's a light hydroxy acid dose, but it's mostly just purifying, kind of pulling that excess oil up and giving a nice deep cleanse to the skin. I think once a week for those acne patients or just oily skin patients would really like that. And then we have the biocellular mask as well. Let me grab this and show it. This we use in office all the time. It's probably our best-selling mask from SkinCeuticals. They come in these individual packets. It's similar in that it's calming and cooling the skin, but we give these post-procedure. So they're great post-sunburn, great for inflammation from the mask, and also put a nice dose of moisture in the skin as well.
They are so hydrating. You're just infusing that water in the skin, and it keeps you nice and cool. It makes you feel like you just put an ice, a pack of ice on your skin, and it's not. It's just a nice, smooth mask. I love it.
And I feel like this, because it's, here, I can open it. Would you like me to show it?
I would love for you to show it, because it's my favorite mask.
Let's open it, because it's very cool. It's very cool.
Very cool.
And a lot of times I'll give these to people for special events. I know that's not happening a whole lot these days.
Yes.
But this, if you leave it on for 10 minutes, again, you could go longer, because you can't leave it on for too long, but at least 10 minutes. So you're going to have this inside the package. And it's this biocellulose material, and it's got 2 gauze. So you basically take one gauze off, apply it to the face, and you can kind of see the order you would go in. And then you remove that second layer of gauze, and it's so cooling. But it gives a nice plumpness, firmness to the skin for hours afterwards. So things look less red, calmer. I think makeup goes on beautifully after this. So this is my special event mask. If anybody says they're going to prom or reunion or wedding, or even I know, again, we're not flying a lot these days, but people who fly a lot love to take these and just kind of it's almost like having a quick facial. In 10 minutes, and then your skin's ready to go for an event, or just if your event is on the couch with your hubby on a Saturday night these days.
Well, and we've been doing events over the internet, so if you're on an online event,
it could be
use it for that too. Yeah, we've been doing all kinds of events like this. We probably should have done it before we did this. So Claire, the final question, because we're getting the 5-minute warning, and thank you for all of these tips. Discoloration defense. In using it, and because we still are affecting it with discoloration, where would you put it in the regimen on the skin right now with everything that's going on to protect it?
So the discoloration defense is tranexamic acid, and it's best if used twice a day. I didn't bring that bottle over, but it's another serum bottle, and it just disappears into the skin. So you want to put it in the morning, you put it on top of your antioxidant. And at night you would put it first thing on your skin. So in the morning, CE on first, then your discoloration defense. So it'd be CE or Floritin, discoloration defense. And then you would layer your moisture and sunscreen.
Perfect.
And then at nighttime you would cleanse, then discoloration defense. And then you would layer your retinoid or your AGE. And that is all over the face versus spot treating generally. And it's great to help reduce brown spots in the skin or brown patches, or this is the time of the year when everybody starts seeing those things come up. And I've actually had some of my patients wearing their mask, and they are getting brown patches right under where the mask is rubbing, so a little friction pigment as well.
It's creating that discoloration right there because it's rubbing it there. Yeah, so really very good to know. So definitely discoloration defense will help with that. So I think we have covered off on all the topics.
Great.
Just making sure we're using a gentle cleanser. I'm just going to review Claire's recommendations. We're going to use a gentle cleanser morning and night, and definitely make sure you're using your antioxidant, whether it's C-fluoric or Fluoretin. And you're going to use some different things. If you're experiencing some breakout, you're having some excess oil production, you've got blemish plus AIDS defense is one of your mechanisms that you can do. You got discoloration defense, your AG interrupter, and of course at night you've got your retinol, and you have your triple lipid you can do morning and night. But my favorite one that she talked about, guys, is the phytocorrective gel. I just smell it, just feels clean, right?
I love it too.
I feel fresh, and I
Yes.
feel rejuvenated with that little gem. And so that's just a hidden gem for those of you who don't know. That phytocorrective gel, I mean, it's for everybody. Yes, it's my little green-eyed beauty.
I love
and
it. I do
it just
too.
makes you feel so good. Yeah. So Claire, before we sign off, I just want to take everybody saying, great job, Claire. We appreciate all your information. They want us to save this.
Thank
And
you.
we've got greetings from Turkey, and they're saying
my
hi to you. I'm all the way from Turkey and Lebanon.
That's wonderful.
Claire,
That's
we appreciate
Nicole.
you doing with us and getting us all educated on how to be
Great.
safe and healthy and have great
Yes.
skin with our masks.
Wear your mask.
Wear your mask. Yes, everywhere you go, wear it. And we'll talk to you soon, Claire. Bye.
Okay, Nicole. Thanks so much. Bye-bye.